How do personal moral values shape opinions on euthanasia? How do personal moral values shape opinions on euthanasia? This question invites us to consider how our beliefs influence our views on a sensitive topic. Euthanasia, or the practice of intentionally ending a life to relieving suffering, has sparked significant debate throughout history. Understanding how personal moral values play a role in this discussion can help clarify differing perspectives. At the core of this issue is the belief about the sanctity of life. Many people hold the view that life is sacred and must be preserved at all costs. This belief often comes from religious teachings or cultural traditions. For these individuals, euthanasia is seen as morally wrong because it involves actively ending a life. They argue that suffering, while painful, does not lessen the value of life itself. This perspective emphasizes that every moment of life has inherent worth, even in difficult circumstances. On the other hand, some individuals prioritize personal autonomy and the quality of life over mere existence. They believe that individuals should have the right to choose how they want to live and die. For these people, the moral value lies in respecting a person's choice to end their suffering when faced with unbearable pain or terminal illness. They argue that allowing someone to choose euthanasia is an act of compassion and respects their dignity. This viewpoint often leads to support for euthanasia as a morally acceptable option in certain situations. Cultural, religious, and personal experiences shape these moral values, making the conversation about euthanasia complex. Some may support euthanasia only when the patient is competent and has given informed consent. This reflects a moral focus on respect for individual choice. Others worry that emphasizing quality of life could lead to justifying euthanasia in inappropriate cases, risking the dignity of life itself. Practical considerations also arise from these moral values. Those against euthanasia often advocate for better palliative care and support systems. They believe that improving care can address suffering without ending life. Supporters of euthanasia may argue that while palliative care is essential, it does not always eliminate all suffering. Thus, they view euthanasia as a morally valid choice. In summary, personal moral values significantly shape opinions on euthanasia. They influence how individuals weigh the importance of life, autonomy, suffering, and dignity. These values determine whether euthanasia is seen as a compassionate choice or a violation of the sanctity of life. The ongoing ethical debate reflects broader questions about what it means to live a meaningful life and who has the authority to decide when it ends.